Pediatrics is the branch of medicine that provides treatment and medical care for infants and children up to the age of 12. The general goal of Pediatrics Department is to provide quality care incorporating aspects of promotive, preventative, diagnostic, curative, and rehabilitation care which is both for the child and family friendly. By the end of this session, you should be able to understand and explain the functions of the department, identify the team players and their respective roles in this department, learn how time can be managed well while training in this department, recognize the roles and responsibilities of a house officer in the Department of Pediatrics, understand and manage the expectations of being a house officer here, and last but not least, understand the pathway to specialize in this field for those of you who might be interested to understand the journey or maybe live one. Let's get started. The term pediatrics is derived from the two Greek words, pais, meaning child, and iatros, meaning doctor and healer. As such, it is intended to mean the healer of children. The forefathers of medicine understood the differences in growing and maturing organisms that necessitated different treatment, hence the beginning of understanding pediatrics as a field of its own. A 2nd century AD manuscript by the Greek physician and gynecologist Ceranos of Ephesus dealt with neonatal pediatrics. The first generally accepted pediatric hospital is the Hospital des Enfants Malades, which is known as the Hospital for Sick Children, which opened in Paris in June 1800s on the site of a previous orphanage. From its beginning, this famous hospital accepted patients up to the age of 15 years, and it continues to this day as the pediatric division of the Necker Enfants Malades Hospital created in 1920. The body size differences are paralleled by maturation changes. The smaller body of an infant or neonate is substantially different physiologically from that of an adult. Congenital defects, genetic variants, and developmental issues are of greater concern to pediatricians than they often are to adult physicians. The clinician must take into account the different physiology of the infant or child when considering symptoms, prescribing medications, and diagnosing illnesses. Pediatric physiology directly impacts the pharmacokinetic properties of drugs that enter the body. The absorption, distribution, metabolism, and elimination of medications differ between developing children and grown adults. Pediatrics can be divided into two main areas. We have the general pediatrics, where a hospital role covering children from birth to the age of 12 in Malaysia, and most pediatricians have this generalist role. And we have neonatology, and this role specializes in looking after newborn babies. It is usually based in an intensive care unit, looking after premature babies or those with problems at birth. Well, there are numerous staff and service providers working together in the pediatrics team to ensure the objectives of the department are met. So it is advisable to be well aware of who your team member comprises and what are their respective roles as part of the pediatrics team. Let's begin with the head of department. The department head usually holds a post of a consultant, otherwise the post can also be held by a specialist in training. The HOD runs the department, essentially looking into the financial needs, resource needs, and overseeing the day-to-day activity of the department. The head of department is assigned to ensure that the department is running smoothly, and they play an important role as a representative of the department to important meetings, raise issues to the attention of the hospital director, and manage the department's budget to ensure adequate medications and equipment are available. Next, we have the consultant. So the ward consultant pediatrician leads ward rounds at least once a week. He or she oversees the patient's diagnosis, investigations, and treatment plans, as well as troubleshoots difficult cases. Then we have the specialist, or also known as a pediatrician. So the pediatrician leads a team of doctors during the rounds. Among the roles of a pediatrician include diagnosing and treating common childhood ailments and minor injuries, recommending patients for further treatment and to specialists when needed, providing preventive care, including the recommendation of vaccines, recording and maintaining the health and development information of their patients, and effectively communicating their patients' health, nutritional, and fitness needs to their guardians. New cases which are admitted from the emergency department are reviewed by them, and the management plan is provided by the pediatrician. Then we have the medical officers, who is your one-up, who reviews the patient with you before the specialist arrives. The cooperation between the medical officers, house officers, and the nurses is essential in ensuring patients receive holistic care during their stay in the ward. It is advisable that the house officer brings forth any setbacks pertaining patient care or management that he or she may face to the medical officer in the ward before the specialist arrives. Then we have the nurses. So the nursing staff in every department is led by the matron of the department. The medical ward sisters report to the matron. So let's begin with the matron. They are in charge of the nursing service division. They are the nursing representative of their wards and clinics to raise issues to the hospital director. They are usually dressed in dark blue. Then we have the ward sisters. The ward sister organizes all nursing activities of a unit in accordance with the hospital policy and rules. Ward sister also directly supervises patient care of the unit and provides direct care to seriously ill patients as and when a situation arises. She takes care of the well-being of the nursing staff, manages and arranges the roster for the nursing staff team, and also helps the nurses carry out their duties if the wards become too busy or overwhelming. And she's usually dressed in light blue. Finally, we have the ward nurses, where they are divided into staff nurses and community nurses. Here, the ward nurse provides direct patient care. They are also responsible for obtaining patients' vital parameters and charting them on the observation charts. He or she will provide comfort to the patient and maintain the safety of the patient. They take over the charge from the duty nurse of the previous shift regarding the patient's instrument supplies and drugs and hand over the same to the next shift. Every day, one of the nurses in the ward will be assigned the medication administration role. So he or she will be stationed by the medication trolley to prepare and dispense medications to the patients. Next, we have the allied health professionals, who are the pharmacists. The ward pharmacists follow the ward rounds led by the specialist or the consultant, and they provide their consultation on the safety of therapeutics prescribed, alternative drug therapy, double checking on dosages, which is very important in pediatrics, in order to prevent medication errors. They also provide suggestions to manage the current medication supply available in the hospital. So you may require the assistance of the ward pharmacist to verify the medications ordered to prevent medication errors. Next, we have the support staff. We have the clinical assistants as well as the lab assistants. So as for the clinical assistants, they're involved in a range of duties associated with the upkeep of the ward environment, cleaning medical devices, and maintaining highest standards of cleanliness throughout. They are also responsible for giving out meals and drinks to patients and ensuring menu choices are completed and communicated to the appropriate department. They are in charge of dispatching blood, urine, or stool specimens in biohazard bags from the ward to the lab counters. Next, we have lab assistants. So they assist physicians in the diagnosis and treatment of diseases by performing tests on tissue, blood, and other body fluids. You and your ward team highly depend on these support staff. Having a smooth relationship with them enables communication to work well and to ensure specimens dispatched to the lab and processed promptly, as well as the results are communicated back to you as per the stipulated time frame. Then we have the imagers, who are also known as the radiographers, and they are certified technicians who capture images of organs, bones, and tissue for patient diagnosis. Radiographers are equipped with the technological skills to handle imaging equipment and the interpersonal skills necessary for patient care. As for the record keepers, they are responsible for the maintenance of medical records. They must safeguard medical records from tampering, loss, and unauthorized use. They are responsible for seeing that the patient's rights to privacy and confidentiality of the information stored within the medical records is maintained at all times. Daily documentation and completing discharge summaries are important roles you play as a house officer, ensuring documentation is appropriate and well done so you can assist the record keepers to organize and store them well for record and reference purposes. Then we have the telephone operators as well as the cleaners. So, to ordinary people visiting or calling into a hospital switchboard operator seems to be doing mundane work. In actuality, these people are wholly responsible for all the communication that goes on in the hospital. And as for the support crews, who include the housekeepers and linen managers, they are important in ensuring the treatment and surgical rooms, patient rooms, labs, as well as public areas are always kept clean and sanitized. The linen and laundry services are responsible for providing a safe, clean, adequate, and timely supply of linen to user units of the hospital at the right time. So you and your ward members depend on the support crew as they keep your ward clean and safe from hazards. You can play your role by ensuring sharps, waste are discarded well, and pose no danger to the housekeepers. Linen managers appreciate your assistance in placing the used linens in their respective bags. Now, let's quickly run through the flow of a patient's admission to the pediatrics ward and the neonatal care unit to get some clarity. Generally, the pediatrics department is divided into the inpatient portion where we have the general pediatric medical wards, outpatient portion where we have the general pediatric clinic, additional rotations such as in the newborn nursery or neonatal intensive care unit, which is an intensive care unit that provides specialized care for newborns with life-threatening medical and or surgical conditions. Let's begin with the nursery. So the house officers here generally receive referrals from the obstetrics and gynecology team. So they stand by in the operating theatre or they stand by in the labor room for vacuum assisted delivery, and if they find the baby to be flat or grunting, where they might perform resuscitation. So details to obtain here would be the reason for referrals, how many babies that are going to be delivered, what's the gestational period, any history of alcohol intake, the estimated fetal weight, and where is the baby going. Here, they would receive the referrals also for stable babies in the labor room. As for the outpatient department, here the house officers are assigned to clerk new cases, to follow up on patients' progresses and also response to management, do necessary investigations procedure under supervision, to review patients' medications as well as to interact with the patient's family and guardian. And as for in the ward, similar to any other department, they're expected to review patients, clerk the patients, perform in procedures such as blood taking, granular insertion, blood investigations to trace the lab results, request imaging, to carry out the active job that is required out of them in the ward, to present cases to the medical officers and specialists, to settle the discharges and the documentation, and to interact with patients' family and guardians. Now let's quickly take a look at time management. So time management is extremely crucial to reap the maximum benefit of training during housemanship. And let's look at a few general tips. Firstly, create a job list. So make a customized table to summarize your ward works and tasks systematically. Prioritize work that needs to be done within office hours. Cross out tasks that has been carried out to avoid confusion between colleagues, and delegate tasks among you and your colleagues such as blood taking, referrals, requesting imaging, assisting in the procedures as well. Next is familiarize with your patient and their surroundings. Get to know your patients well and their surroundings. Allocate at least 10 to 15 minutes to review your patients. Remember the important things about your patients and the significant results. Check the necessary parameters and attachments on your patients. Save the necessary emergency contact information for the day, such as the specialist or physician or the medical officer in charge or on call, as here in Malaysia, we do not use the pager system. Tip number 3, take turns with your colleagues if you wish to take a break and notify your team members or senior colleagues on your whereabouts to ensure miscommunication is avoided. If you're working in the NICU, ensure that you're always there to reconfirm your patient's cases, as most of the cases there are critical cases. Finally, tip number 5 is to use electronic and digital productivity tools. So here, utilizing the reminder, notifications, and planner apps or systems can not only save your time, but also it ensures tasks are completed. So what is expected out of a house officer in this department? So house officers are expected to obtain informed consent and take a history and perform physical examination, as you'll be the first person to see the patient. Your role as a house officer here is to assist your MO and specialist to carry out clerking, assisting in procedures like drawing blood, starting IV lines, placing urinary catheters and nasogastric tubes. You will also get the chance to perform other invasive procedures under the supervision of your superiors. If you notice any abnormal findings, you must immediately be able to inform your superiors and ultimately be able to communicate with patients and families about the disease process and the plan of care. So be well reminded that your area of work encompasses the pediatric wards, pediatric clinics, as well as pediatric nursery. Now, as you progress through this specialty and you find yourself having an interest in this field and plan to specialize in it, how do you go about it? So there are 2 pathways for training as a pediatric specialist, which are the university pathway and the MOH or parallel pathway. So let's first take a look at the university pathway, in which we can see that this pathway caters for eligible trainees who wish to apply for scholarships or private or self-funded candidates. Candidates who opt for the university pathway will be required to successfully pass the Pediatric Entrance Examination MEDICS. This examination is conducted twice a year and can be taken during their housemanship itself. This qualification is valid for 3 years if passed. Eligible trainees may apply for a scholarship from the Ministry of Health Postgraduate Training Division, and following a screening process, successful candidates will be notified on the award of scholarship. The candidates, while in the Ministry of Health scholarship is being processed, must apply concurrently to the Ministry of Education to enter the master program before the scholarship closing date. And successful candidates may be invited for a formal interview conducted by the Conjoint Board of Pediatric Training if the selection committee wishes to meet the candidate in person or for any evaluation or past training. For private or self-funding candidates, they may apply directly to the university of choice. Applications may be made to multiple universities. The process of entry and admission to the program is subject to the individual university guidelines. And upon entry into the program, they can then begin their training in pediatrics, and this will span 4 years, where they will be going through 3 stages of training. Upon completion of training, they will be undergoing a gazettement period for 6 months and another 1 year of training as a pediatrician before they are eligible to apply to the National Specialist Registry. The MOH pathway is a parallel training program carried out in the accredited MOH hospitals. So candidates from the Ministry of Health who are seeking to pursue training on the MOH pathway may not necessarily be in the pediatric posting or an accredited training posting in MOH, or they could already be in a pediatric posting but not as yet registered with the MOH as trainees. They then should proceed with registering themselves with the Medical Professional Development Unit in the Medical Professional Division, also known as Bahagian Perkembangan Perubatan of the Ministry of Health, after fulfilling the entry requirements, which are having a temporary or full MMC registration, completion of housemanship training, completion of 4 months of pediatric posting as a house officer or medical officer, successful completion of all required pediatric and trustable professional activities, passed one of the 3 theory MRCPCH papers, which include the Foundation of Practice, or Theory and Science, or Applied Knowledge in Practice, which is Part 2A. As soon as they have received their results on the application made, they may then begin their training in the specialty and should take not more than 4 years to complete their workplace-based training coupled with the MRCPCH clinical examination by the end of their training. Then, this is followed by 6 months of gazettement and another 1 year of post-qualification training before they can be registered with the National Specialist Registry. This is the list of recognized postgraduate qualifications in Malaysia in pediatric medicine. So these are the local and overseas programs that are recognized postgraduate qualifications to practice as a registered pediatrician in Malaysia. You may find this list on the Malaysian National Specialist Registry website. Next, let's take a look at subspecialties in pediatrics. Among the subspecialties in pediatrics are neonatology, pediatric cardiology, pediatric hematology or oncology, pediatric surgery, pediatric emergency medicine and critical care, pediatric infectious diseases, pediatric hospice and palliative medicine, pediatric pulmonology, and adolescent medicine. So in summary, we have looked at what does this department essentially deal with, who are the essential team players that make this department, simple tips on how time can be managed well while training in this department, understanding the roles and responsibilities of the house officer in the department, what is expected out of you while you are on duty as a house officer here, and finally, the pathway to specialize in this field upon completion of housemanship training for those of you who are keen to join this field of medicine. There are plenty of online resources available to assist with your learning process while you are in training as a house officer in the pediatrics department. You are encouraged to be resourceful as it makes your job easier. Here, we will be going through some useful resources to aid your quest for department-related information and skills training. Let's begin with the first one. The National Institute for Health and Care Excellence Children and Young People Guidance provides up-to-date guidelines and best practice standards for pediatric medicine. They are evidence-based recommendations for health and care in the relevant fields of medicine in England. Next would be the College of Paediatrics in the Academy of Medicine Malaysia, which works closely with the local universities in the Paediatric Conjoint Board in the development of the local postgraduate pediatric education. On this side, you can learn more about the training and examinations available to further specialize in this field, as well as the resources such as the clinical practice guidelines available for pediatrics. Next is an essential summary put together by a group of doctors not many years ago. The interesting concept of a quick reference guide which is used here is helpful for immediate reference and recalling classifications. It is an elaborate guidebook to the specifics in the department from aspects of prescribing, examination, and patient history clerking. This resource is available online in a PDF format. Geeky Medics. Geeky Medics Pediatrics Note is part of a compendium of a comprehensive collection of visuals, notes, flashcards, and many more interesting tools online for the Department of Pediatrics. Geeky Medics has an extensive compilation of clinical skills videos to assist doctors in training with their learning. Next, this is something you won't be able to live without in pediatrics. The Frank Shan Drug Doses booklet, which is one of the most extensive used references in Malaysia for pediatric drug dosing. Frank Shan Pediatric Drug Dose is a worldwide first-line guidance used in pediatric department in prescribing strict doses for pediatric patients. It is a must-have for all doctors. Let's take a look at a few YouTube playlists. First would be the channel called Royal College of Paediatrics and Child Health. This is the official YouTube channel of the Royal Colleges of Paediatrics and Child Health in United Kingdom. Their playlists include webinars, podcasts, online workshops, quality improvement programs, and also a latest edition on COVID-19 as well. Next would be Open Paediatrics. Open Paediatrics is an interactive digital learning platform designed to promote the exchange of knowledge between physicians and nurses around the world caring for critically ill children. It is an online community of clinicians sharing best practices from all resource settings around the world through innovative collaboration and digital learning technologies. Next would be the past MRCPCH London Paediatrics Trainees Committee. This channel showcases MRCPCH clinical exam revision videos and content created by the London Paediatric Trainee Committee. There are plenty of videos on examination skills and techniques shared online to aid candidates ace through their clinical exams. And finally, we found another interesting channel to share, which is Easy Pediatrics, which is a channel for educational webinars in pediatrics. The web videos here guide the learners on multiple aspects of pediatric medicine, from recognition of signs and management protocols. So we have finally come to the end of this session. We hope this session was insightful and thank you for your time.